Fluoride is essential to dental health, and because of this, it's currently added to the water supplies of around 400 million people in some 25 countries around the world, including those of around 10% of the UK population and 60% of the US. For decades, fluoridation has been seen as a cheap and simple way to improve people's teeth, but the practice is being called more and more into question. On the one hand, the UK is currently consulting on introducing its first new fluoridation schemes since the 1980s to try and improve dental health outcomes for children, while the London Assembly's Health Committee just last week urged the Mayor Sadiq Khan to review whether London's water supply should be fluoridated for the first time. But in America, the picture is very different. Robert F. Kennedy, Trump's pick for the head of the US Department of Health and Social Services, has called fluoride an industrial waste and indicated that Trump would advise its removal. As you would imagine, there has always been some opposition to adding a chemical to something which people have little choice but to drink, and the practice has fueled conspiracy theories since it began. But the science is continuing to evolve, and a recently published study has made headlines by linking higher fluoride exposures with a decrease in IQ in children. So should we be concerned? And should we call time on adding fluoride to our drinking water? First, what is fluoride? Fluoride is a form of the element fluorine, but with one extra electron. It occurs naturally in many foods, drinks, and some water supplies. It's also a component of most toothpastes and mouthwashes, and this is because of its benefits to dental health. Think of your mouth as a war zone. Every day, acids formed from bacteria, plaque, and sugars attack the enamel of your teeth, causing them to lose minerals. If your teeth lose too many minerals, then the result is tooth decay. But when you consume food and water that contains these minerals, you replenish them. And so in order to avoid damage to your teeth, you have to gain more minerals than you lose. One of these minerals is fluoride, and so consuming it strengthens your enamel and helps prevent tooth decay. It can even reverse early tooth decay. But how was this even discovered? Well, kind of by accident. In 1901, a young dental health graduate, Frederick Mackay, noticed that the locals in Colorado Springs had strange brown stains on their teeth, and no one knew why. Joining forces with dental researcher Dr. Green Vardamant Black, the pair discovered that the staining occurred while the teeth were developing. Young kids waiting for their secondary set of teeth to erupt were at high risk of stained teeth, but those whose teeth had calcified without the staining wouldn't get the stains later. Secondly, the pair found that teeth afflicted by the stain were surprisingly resistant to decay. To cut a long story short, Mackay, through travelling to towns around America whose inhabitants exhibited this curious staining, was able to determine that it was due to something that was in the local water supplies. A chemist, H.V. Churchill, was able to determine that the supplies exhibited naturally high levels of fluoride, and so the mystery was solved. From there, researchers led by Dr. Trendley Dean were able to determine that fluoride levels of 1 mg per litre of drinking water did not cause those brown stains, now known as enamel fluorosis. But remembering that these stained teeth were curiously resistant to decay, he reasoned that putting a small amount of fluoride into drinking water could improve dental health. The city of Grand Rapids in Michigan became the first city in the world to fluoridate its drinking water in 1945. So does it work? Well, in Grand Rapids, after just 11 years, the rate of tooth cavities among children dropped by more than 60%. And so it was heralded as a huge scientific breakthrough. For the first time in history, tooth decay had become a preventable disease. In 1950, federal officials endorsed water fluoridation, and programs were instigated throughout the United States and subsequently the world. An updated review of water fluoridation studies was published last year, and the authors reached a few conclusions. Studies conducted after 1975 showed that adding fluoride to water may lead to slightly less tooth decay, and that while studies before 1975 showed a clear and important effect on prevention of tooth decay in children, due to the increased availability of fluoride in toothpaste since 1975, it is unlikely that we will see this effect in all populations today. So in short, Yes, it works, but with most people using fluoride toothpaste nowadays, it's less of a game changer than it once was. But just because something is less effective than it once was, isn't much cause for concern. What about claims that fluoride could actually be bad for health? Determining the amount of fluoride to add to water is a balance between protecting teeth from decay while limiting other impacts like the teeth staining. The World Health Organization recommends a dosage of no higher than 1.5 milligrams of fluoride per litre of water. In fact, in both the US and UK, the actual doses tend to be much lower. To put that into context, the water supply in bauxite that was causing the brown stains was 13.7 milligrams per litre. But studies have emerged that suggest higher doses of fluoride could cause more serious problems than stained teeth. In some areas of the world, water has a naturally high fluoride content, including some parts of China, and it is primarily from China that studies have emerged that suggest a link between children who grew up drinking water with high fluoride levels and a lower IQ level. Now, some, probably most of these studies were poor quality, but they did grab the attention of researchers, and hot off the press is this review, published in January 2025. Conducted by the US National Toxicology Program, it analyzes 74 studies from 10 countries. Notably, no studies were from the United States. Their analysis involved picking apart the methods of each study, considering such factors as the age of the children involved, how they were tested for intelligence, and how their exposure to fluoride was measured. By doing this, they could ascertain which were the best quality studies and which should be treated with greater caution. The review did find an association between lower IQ and fluoride levels. The analysis found an IQ score decrease of 1.63 for every 1 part per million increase in fluoride in urinary samples, which reflect the total exposures from water and other sources. Dropping a few IQ points sounds scary, but in reality most people wouldn't even notice the difference. But as the study also notes, a 5-point decrease in a population's IQ would nearly double the number of people classified as intellectually disabled. However, there are two things to note. One, these studies concern children. There's no evidence linking fluoride exposure and IQ in adults. And two, these studies relate to estimated fluoride exposures higher than what you generally associate with the US and thus the UK and much of the world. Dr. Stephen Levy, a professor of preventative and community dentistry at the University of Iowa, stated, "Despite the presentation of some evidence of a possible association between IQ and high fluoride levels in water, there is no evidence of an adverse effect at the lower fluoride levels commonly used in community water fluoridation systems." However, while artificially fluoridated water is currently of little cause for concern, there are other ways in which children can consume higher levels of fluoride. As I mentioned earlier, your fluoride intake doesn't just come from water, but also from certain foods and drinks, from black tea to potatoes and the pesticides we use to grow them. And some scientists are worried that the combination of these with fluoridated water could cause children to ingest higher fluoride levels, while pregnant women could pass excessive fluoride onto their unborn child at a point where their brains are at their most vulnerable. So if you're an adult, there's currently no evidence you should be concerned about fluoride at all. But if you have young children or are pregnant, then it is something to keep an eye on. But as with many health interventions, it's a balance. Tooth decay is a serious health condition in itself. But is Robert F. Kennedy correct that fluoride is an industrial waste that should be removed from tap water? Well, while the science is evolving, at the levels it's currently added, there is no evidence today that it is harmful. But there are 3 million Americans drinking water with a higher fluoride content than the recommended amount. Difference is, that's because it occurs naturally in their water supply. If you want to see more videos from us, please do press that subscribe button.